Hi, I am Moriah Holloway. I am a student at Western Michigan University, part of the Department of Occupational Therapy, and my project was on the impact of reminiscent kits in reducing behaviors in people with dementia. So, my project started in January 2025 through April 2025 over the period of 14 weeks. My site was at Hubbard Hill Living Wisdom Center in Elkhart, Indiana. At this facility, it's kind of like household. So depending on the stage you're in, there's four homes, about nine residents per home, and you're based in the home based off of the stage of dementia you're in. So I did my project in the high functioning house and then the advanced staged house. My site mentor was Deborah Caribou. She is a nurse and very well versed in the world of dementia. And the ACOT concentration areas were mainly clinical, practical skills, program development, and education. The purpose of this project was to first develop and then implement the use of reminiscent kits as a non-pharmacological alternative to reduce behavioral symptoms in individuals with dementia. So, to start off, for my abstract, this capstone is really to explore how reminiscent kits using robotic companion animals and hyperrealistic babies, that was the pets and babies were the memories that I was trying to help reminisce. And then use these reminiscent kits with those items as a non-pharmacological way to reduce behavioral symptoms in people with dementia. So these tools are used to help with emotional regulation, engagement, and overall quality of life with these individuals. And they were specifically tailored to the cognitive level they were in. And the staff showed that there was a reduction in, or the results showed, sorry, there was a reduction in agitation. Mood was improved, and there was more communication and verbal communication, nonverbal communication between staff and family and the residents. The staff found these kits were really easy to use and super helpful for daily care. So this project is going to highlight how occupational therapy can provide simple and meaningful tools that can make a difference in dementia care. So as far as literature review goes, dementia is not going anywhere, and it's growing. So we need tools out there to really help with this population, and it's typically characterized by memory loss, cognitive decline, and behavioral symptoms. And those symptoms a lot of times include agitation, aggression, and even wandering, which can be very dangerous at times. So typically with this population, they're treated with medication, but with medication comes risks, right? So it's an increase of falls, it's an increase in hospitalizations, and kind of more cognitive decline when you use medications. So the reminiscent kits provide you with a different alternative using the robotic pets and baby dolls and the sensory tools that correlate with them to help kind of trigger those long-term memories and emotional responses that they may need a little bit more assistance getting back to. So the robotic pets, if you don't know, they have fur. If it's a dog, they bark. If it's a cat, they purr. The pets are really used to really simulate or imitate the realistic thing. And the same with the baby. The baby cries. You can feel and hear the heartbeat. It looks like a baby. It feels like a baby. It smells like a baby. You're just trying to do your best to get back to the realistic thing without the realistic thing. As far as sensory tools, goes to expand on that. If it's a baby, if you're working with a baby reminiscent kit, you have a baby blanket. If you're working with the cat, you may have cat toy or a food bowl or even a booper scooper, just to kind of help trigger those memories. And they all feel different, and they have different textures with them. And if it's a dog, you have a dog toy, a leash, different items that correlate with that specific um, thing that you're using at the time. So therapeutic benefits observable, sorry. Um, Research shows that there is a decrease of agitation, anxiety, and withdrawal when using reminiscent kits or these tools. And the population shows more emotional expression. You provide them with purpose and more social engagement. Emotional reactions matter with this because with using this project, sorry, because with dementia, they struggle with initiating different emotional responses. And this supports person-centered care because you're getting back to those identities or roles or preferences of that person that they may struggle with getting back to themselves. You're also improving interaction between staff and residents and sometimes family. So the behavioral outcomes that come along with this is, again, reduced aggression and improved mood. And it can be really effective, especially being in post-COVID era with isolation as well. But with things like this comes challenges, and some of those challenges includes cost, staff training, and storage. And then you also get different responses from people, and sometimes not just different responses from different people, but different responses in general from the same person sometimes. So for a needs assessment, this was conducted prior to the 14-week experience. I interviewed my mentor. I interviewed Tanya, who's the director of Living Wisdom Center, Lucy, who's the activity director, and nursing staff. And from that information, I gathered some of the strengths. There are activities that take place just about every day there. They have a high staff to resident ratio. And if something goes wrong, there are in the moment assessments that are performed with the residents there. Some of the weaknesses, though, were that there are daily behavioral challenges. And then there's limited articulation sometimes, and of course, practical challenges. Some of the opportunities, though, there are a lot of opportunities there, is for this project is an introduction of a new intervention. And staff are really open there. Staff are really supportive there. And typically with the staff there, there is enhanced training and understanding prior to coming there at the Living Wisdom Center. Some of the threats, though, included that there might be some challenges with implementation logistics, measurement of effectiveness, resident acceptance, and resource allocation. Over my time, these are some of the objectives that were met while I was there. I was able to design a tailored intervention program using Reminiscent kits, and they were customized based off of the stage or the house I was in, so the high functioning and advanced stages. And when I left, you'll see also in Appendix A, I did leave tip sheets and engagement questions to help promote the engagement and meaningful interactions with these kits as well. My second objective was to gather feedback on usability and benefits. With this, I used a lot of informal conversations. So every week or every time I was there, I did have conversations with the staff just to check in to see how things are going, or they would give me feedback on a particular resident that might benefit from it more, or different things like that. They really gave me tips, and it was a lot of back and forth communication. Um, and staff really reported increased confidence with these kits, and they were incorporated into their care routines for some of them. And for the third objective, I was to compare pre and post interviews for resident and caregiver outcomes, and that the interview questions will be found in Appendix B. So there wasn't a lot of like formal data collection, but a lot of things that were collected were observable. And a lot of the staff, and even I saw a lot of improved emotional responses from residents. There was increased engagement and reduced agitation. And the staff also were provided with a tool to help respond to the needs more immediately than just relying on medication or getting the nurse. As far as implications of OT, again, the staff are equipped to help with reducing agitation and promote emotional connection with the residents there. The staff felt more confident with using these tools, thanks to the prompts, thanks to the handouts, thanks to the things that are provided with the kit. The site will plan to sustain this program. They plan on incorporating it and putting it throughout more of Hubbard Hill there, and then also implementing staff trainings and daily care routines. And as far as occupational therapy, this really promotes the value of sensory-based, person-centered interventions. It highlights that, um, you know, OT's role in developing sustainable quality of life focused programming in dementia care. So to conclude, this project showed that reminiscent kits can reduce behavioral symptoms and improve connection in dementia care. Staff found these tools easy to use, and the residents responded really positively. This program is sustainable and enforces OT's role in promoting identity, emotional well-being, and quality of life. And the following are my for the cat. for the dog and for the baby, and then my pre and post interview questions. Thank you.